A patient safety campaign is very important because it focuses everybody, clinicians and all the teams on the wards, to think about how they actually do perhaps hinder a patient's recovery and things that they might not even believe that they do. When you look at it, when you tell them, when you talk about it, they're shocked and they want to change that. So you have to harness then that enthusiasm for change and run with that. I think we've been extremely lucky in that from the very beginning, from the executive board down, the campaign has been received well. Our former chief executive and our acting chief executive now have really put their full weight behind the campaign, and we have made the 1,000 Lives campaign and patient safety the first item on every agenda in this trust. So every meeting discusses the 1,000 Lives campaign. The NHS in Wales is changing. Has recently changed for us as a trust, you know, 2 became 1. There's further change to come. And really the 1,000 Lives campaign gives a focus to the care delivery that all of us are here for, and brings teams together perhaps sooner than they would have during a normal change process. So for instance, the pressure ulcer prevalence project, which I've been involved in, we got the tissue viability nurses from both sides of the new trust together. They told us who else they thought needed to be there, and that got them talking a lot sooner than I think they would have if it hadn't been for the focus of the 1,000 Lives campaign and patient safety. I mean, I think there are other areas where it will help to bring people together. All of the content areas, we are now looking at groups across the whole of the new trust, and introducing people who, you know, would really not have met until much further down the line. So, you know, we've got our critical care bundles that we've talked about. Those groups are representative of the whole of the trust. We're using patients from both sides of the trust to help inform us of how we're doing, and you know, some of our patient representatives have been here today in this event to help us to manage the event, and that's great. So it brings people together very, very quickly, and I feel much quicker than you would ordinarily get people around a table, because it's a focus, and the focus is improving patient care. I mean, patient safety is our primary aim, as you know, and during change, everybody is worried about themselves, where they're going to be, what they're going to be doing, but keeping patient safety at the top of the agenda is the right thing to do. We should be doing it, but it helps us during this period of transition. It makes us remember what we're all here for, and that's to give good quality care. The 1,000 Lives campaign for me gives legitimacy around really looking at how we improve care. Not that we didn't do it before, but having the national campaign with our politicians behind us, with the Minister for Health launching that campaign, it really puts it truly at the top of the agenda. It's about how good we are at delivering care and how we can improve. And we're going to be able to show that in 2 years' time. But it'll go on far longer than that, I believe, because the alliances that have started now, the work that started now, will help us to use the methodology in the future to continue to look at other areas where we can improve.